the last 2 weeks. 10 are confirmed close contacts of cases, and 6 have neither a recent travel history nor a known contact, while 6 were just recently detected on an offshore oil vessel. 3 persons have been discharged from treatment, and as we said yesterday, we have sadly lost 1 patient. All 61 presently active cases are clinically stable with only mild or moderate symptoms. With the increasing number of cases, Lagos is still the epicenter of the COVID-19 outbreak in Nigeria. I commend the work of the Lagos State government, particularly the Ministry of Health. They have scaled up their response activities, and the Nigeria Center for Disease Control is supporting them, as well as other affected states, through the rapid response teams deployed there. Health facilities and health workers at all levels, whether public or private, should remain on high alert and maintain a high index of suspicion to give full cooperation to contact tracers everywhere. While stations, land borders, and international airports remain closed, precautionary measures are also being taken by the federal government to protect our seaports. Only ships that have been at sea for more than 14 days can dock in our ports after crew members have been confirmed negative for COVID-19. An exception to this 14-day restriction are vessels carrying oil and compressed natural gas products, because they require minimal or no contact at all between the crew and the ground personnel. The federal government of Nigeria has released 10 billion naira grant to Lagos State to increase its capacity to respond to COVID-19 outbreak. Another 5 billion naira special intervention fund has been released to NCDC to equip, expand, and provide personnel to its facilities and laboratories across the country. The federal government also, through the Nigeria Air Force, has made provisions to bring back essential NCDC staff who have been away on training but could not return to Nigeria due to the instituted measures to close down airports in Nigeria and other countries. One major item in our disease containment strategy is social distancing, which we emphasize again, and it is again being repeatedly announced. Directives have been issued at national and state level to limit large gatherings, including religious, social, and political gatherings, while schools and event centers have now been shut down. Some states have put the maximum number of gatherings at 50, but a general order will be announced soon. Markets are closed in some places, and alternative solutions to the food supply chain have been created. More measures may need to be instituted by the federal and state governments as the situation evolves. Once again, the inconveniences are regretted, and we do enjoin you to pass that on to the Nigerian population. And I urge all citizens to please accept and practice these instructions, as they are for our own common good and in the interest of all of us. These directives are not only being implemented at state level, but also at federal level. As you all know, the weekly Federal Executive Council meeting has been suspended till further notice. The circular has also been issued to the head of service of the Federation to direct public servants on grade level 12 and below, those who are doing non-essential roles, to work from home. The other critical measure we are taking is contact tracing, which is going on all over the country, to identify persons who have been in close contact with confirmed cases. The Federal Ministry of Health is working closely with states and the Presidential Task Force on COVID-19 to review response activities and to institute measures to protect the health and well-being of Nigerians. The Multi-Sectoral Emergency Operations Center, led by NCDC, coordinates it and other national response activities. NCDC has launched a WhatsApp platform, a free-to-use service to provide a central source of accurate, verified, and current information on COVID-19 in Nigeria. More details can be found on NCDC COVID-19 website and on social media platforms. NCDC has also launched a communication campaign themed Take Responsibility, and it is a call to all Nigerians and residents in this country to join forces and be proactive in taking greater individual and collective responsibility in preventing and controlling the spread of COVID-19. Please join this collective effort through your social media platforms. Importantly, I again remind all citizens that this is not an assignment for government alone, but for all of us. I urge you to play your part in your own little way by taking social distancing very seriously as a mark of your individual social responsibility and your contribution to preventing the spread of the disease in Nigeria. Ensure you maintain at least 2 meters of physical distance between yourself and anyone who is coughing or sneezing. I thank all Nigerians who have supported government's effort to contain this pandemic. These are no doubt trying times, but with our collective action, we will surely surmount the pandemic. Those who have had contact with confirmed cases or have returned from overseas travel in the last 14 days should strictly observe self-isolation and then call in or register themselves on NCDC platforms. This is not meant to be punitive, and you should not leave your house during the self-isolation period. If you are in supervised self-isolation, make sure you call in as required, and as much as possible, stay in one room. Strictly limit your contact with others for the sake of your own family. I want to remind you in this connection that elderly people over the age of 50 are more vulnerable than people who are younger. Therefore, you need to protect the older ones in your family. If during self-isolation you develop symptoms like cough, fever, shortness of breath, or general feeling of unwellness, avoid self-medication and contact NCDC Connect line on 0800-970000 or call 112. For emphasis, I again urge all of you to take your health seriously and protect others by continuing to do the following. Regularly and thoroughly wash your hands with soap and water, and if not possible, use an alcohol-based hand sanitizer. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing repeatedly. Be sure you and people around you follow good respiratory hygiene, meaning that you cover your mouth and your nose with a tissue or handkerchief when coughing or sneezing, and dispose of the used tissue immediately. Alternatively, use your sleeve and cough into your sleeve at your elbow level if you do not have tissue available. Do not mingle with people or congregate unnecessarily, but rather stay at home if you feel unwell with symptoms like fever, cough, and sneezing. Do not abuse chloroquine or any medication or derivatives until they are officially validated and approved by global authorities. Misuse of drugs can do you harm. Nigerian doctors are participating in clinical trials to verify the efficacy of some of these drugs. NCDC hotline, available around the clock, is toll-free, which means you do not pay for it. Various states also have hotlines that you can call for direct state-specific questions on COVID-19. We urge citizens to use only these lines for legitimate reporting and inquiries and not for fun or for joking purposes. Thank you very much for listening.
Thank you very much, Honorable Minister. Now we take some questions. Please signify if you have questions and make the questions as brief as possible. Okay.
Good afternoon, Minister. My name is Chima Wambo. I work for Rise News. You just mentioned that 6 people have been found positive on a vessel. Today, we saw something from the NPA, the papers that they refuted it. They said that they didn't know of any people that were positive. Because it's clarification.
Okay, thank you. Any other questions? Okay.
Yes, good afternoon, Honorable Ministers. My name is Moses and I'm from the Nation newspaper. Sir, I know the federal government, the ministry, have advised the states to start identifying treatment centers and finding ways to begin to get them ready. Now I know that some states, as we are, some people might be complacent because they've not seen one case or two cases, to scale up this process. Please, I want to know, what is the ministry doing to engage these governors, to engage these states people to scale up their process, even when they don't have any case? That's number one. Then number two, sir, you said in one of our briefings, you told us that you told us in few days, in quotes now, that we should have new test labs. So I want you to give us probably an update on that. We have some labs coming up very soon. Thank you, sir.
Okay.
My name is Jonas from Champion Newspaper. Just yesterday, there was a briefing by the CBN governor where he said the federal government needs to over 120 billion to tackle this challenge. And they called for donation from individuals and corporate organizations. I want to know, is there any donation made by any individual apart from the Chinese foundation that was donated to my country? Has there been any donation made by any single individual or corporate body in Nigeria as of today? Thank you.
Okay, we'll take these questions and then we'll take another round. Honorable Minister.
Yes. To start with the first question you raised, the information we have is that there's an offshore vehicle of which one person reported sick, and that person was lifted out and tested and found to be positive, and so other members of the crew were tested, and the one who was sick was positive. The other people were tested, they were positive or they were not yet sick. So that's a classical case of community transmission, in that if one person has the problem and you lock them all together in one ship the way they were, the likelihood is that everybody will be infected. The advisory we also have is that if you stay in an open space, and this is important of social distancing, the likelihood of getting infected is very low. But the more you are crowded together in a group, then the risk of infection is high. So therefore, the distancing we are talking about is important for individuals, for groups, and we say avoid crowds, avoid large gatherings because of that. So the one in the vessels is still being followed up, and as information comes out, we'll begin to refresh it. Now, with regard to the treatment centers, many of the states were engaged. As a matter of fact, I have engaged the states twice, or rather they engaged me twice, and all the state governors were conscious of the fact that they need to have special centers for treatment and ICUs. But what is important to know now, and what we are doing here at the federal level, is that it's become clear that the coronavirus infection manifests itself in several ways. There are those patients who have no symptoms, There are those who have mild symptoms. There are those who have moderate symptoms. And there are those who have severe symptoms. Only about 4% will have severe symptoms that they will require critical care or ventilators. The remaining 15-60% of that will have moderate symptoms we can manage in regular hospital. So therefore, preparing only ICUs is not enough. We must prepare hospital wings for the mild and moderate cases who need to be isolated. Some of them need to be treated. Others need only to be observed because their own immune system will be activated and can tackle this virus. So therefore, the advisory to all states is to also prepare isolation centers of different levels for citizens who do not have need for ICU or for ventilators, who have mild and moderate cases and need to be treated, but also need to be isolated from the rest of the community for the period for which they are able to transmit. That's the purpose of the isolation, so that there is no risk of transmitting to members of your family, to members of your club, or to others who don't even know you. Now, the question of new labs is being actively pursued. We are trying to reconfigure certain laboratories we already have to be able to do this test for coronavirus. I already mentioned that we are looking at the labs in Abakaliki, Ibadan, Maiduguri, and so on. And we have a donation for a laboratory in Kano, which we are placing in Kano, and to scale up their testing. We have also ordered yesterday, which the permanent secretary has sent out information, that all laboratories now should, the ones working now, the 5 we have now, should be working around the clock in shift, so that you have shifts working around the clock and not just during daytime. We are doing that in order to increase the speed, or rather the number of cases that can be tested in a day. So with that now, we hope we'll get more. If we do more case finding, they can be tested as early and as quickly as possible to increase the turnover. As for donations, yes, we have received donations from the Chinese embassy. We also received donations from Mr. Jack Ma, and we have promises of donations from the United Nations family, from the European Union, and support from various other countries bilateral with whom we have bilateral relations. The Chinese government has promised to give us technical support for some of their experts, so we'll connect with their experts on public health and the infection prevention and the control measures, and also their experts in clinical management. So we shall be taking up that offer to get the expertise directly from China, who have a lot of experience in this with this problem. Those are the questions.
Okay, channels.
Good afternoon, sir. My name is Friday. I'm a reporter with Channels TV. I'd like to know, most states across the country are already locking down. Some states have announced as of today that the latest by midnight today, nobody will be allowed into the states or out of the states. I believe that the days ahead, many more states will follow suit. Are there plans for palliative measures, especially for those who are not civil servants? Since we are giving the instruction to stay at home, is there going to be any palliative measure to cushion the effects of stay at home for those who are not civil servants, who are not on the payroll of the federal government or state government as a case may be?
Good afternoon, Honorable Minister. Great job for the new agency of Nigeria. Honorable Minister, some Nigerians will wonder that are we just fighting against the virus, or we are making use of the available opportunity of the virus to build our health system?
Okay.
Good afternoon, sir. My name is Basil Okaba. So I want to know, after the brief yesterday, this is discovered, 14 of them said, I want to know whether you have community contact or they have overseen business.
Please repeat your question. Somebody marching around with shoes here. Please shut that door and don't let anybody come in again.
Yes, sir, I repeat again, after the brief yesterday, the new cases discovered, instead of them, we said, I want to know if it was through community transmission or contact, or do they have a history of over security?
Yes.
Last question.
I want to know, as it is now, it's worrisome. Do we have challenge with contact tracing?
Yeah. Okay, thank you very much. First of all, contact tracing is a very intensive job. It's left to experts. It's led by those who are specialized in that field, and it means going down to the grassroots to find the addresses that you are given and check out the people and check out the phone numbers. I want to use the opportunity to appeal for cooperation from everybody, from all citizens generally, and also from as a cooperation of the law enforcement authorities and of community leaders and local government and state leaders, because there are areas where people immediately are suspicious when you come asking questions. It is meant for our own good, so provide the information that they request. There are also situations where some people deliberately give false address or false phone numbers. That is not a good thing. It is not helpful. It is not meant to inconvenience you. It is meant to help the community in which we live. So the community tracing generally is led at state level and led by people who know the communities. So you recruit people from each community to lead the way, so that it's not every area that you see absolutely strange faces. And we're able to use that method to track down those who may be in need of testing. Now, the other question about building the health system, yes, every country who's in this situation is also discovering the weaknesses they have in their health system. Most health systems have been overwhelmed, and they have had to think of new ways of rebuilding their health system. And we are doing the same. We are going to use this method to learn some lessons and rebuild our health system, and know that if you have a weak health system, you are going to pay a very high price when a problem comes up, like this one now. Many countries who thought they had very strong health systems are very surprised to see that they are so overwhelmed in a way that they didn't expect. Yes, so we are going to be building health systems, strengthening health systems at all levels, from community to federal level. Now, about states locking down and the palliative measures, yes, we are working very well with NEMA, National Emergency Management Agency, and they are looking at being able to support communities with the needs, necessary needs, essentials, and to do the needful for which they are trained and equipped. So the community sense of helping each other is also there. People help each other in community, and it's helpful when within a community, for example, one person goes to do the shopping for everybody, takes money from everybody, and then goes to do the shopping, and then returns the shop, so that not everybody is trooping to market. So that kind of community support is necessary to reduce exposure to risks. So they take it in turns to do shopping for their communities, and also to help each other with needless travels and needless movement. So that is the point for support and palliative measures.
Honorable Minister, Permanent Secretary, gentlemen of the press, thank you very much for this moment and this time. And that brings us to the end of this press briefing. Thank you very much.